my story, and it's a simple story. Fell on hard time, didn't have a place to stay. So I got sick.
I've worked all my life, and I've never been on welfare or anything.
And then I started my own business, and then I retired from that, and then I went back driving a delivery truck until I was 75. And that's when I got hurt and I had to go back to work.
After I lost my job, it was just so hard to keep up my bills. But that was a big problem, and I was like a little bit getting behind in my rent.
And I came to aging the same way as most folks have. My grandmother going right to the facility after she broke her hip, and just saw the struggle in terms of getting good information, making good decisions, and being sure that we met our obligations as caregivers and our love for our relatives. In 1965, we were seeing that the advent of an unprecedented growth in the number of older people in the United States. And it required us to start thinking in terms of what would be a fair burden on an older person to get basic health care, what would be a fair burden on an older person to get basic support when they're impaired or frail. And that created the impetus to develop an Older Americans Act, Medicare and Medicaid, addressing the health care, the community supports.
And a lot of these people that need these programs are having to choose between a prescription drug and eating that week. So these can be really, really major issues, major help that the consumers need, and very, very urgently.
But you know, when you didn't have the money for the groceries like you wanted to have, like fruit, you know, you have to kind of, well, maybe I won't have that apple, maybe I'll get, you know, something else. I just have to leave off something, you know, to make ends meet. And I saw the AgeOptions leaflet on the desk, and I picked it up and I said, oh man, this is great. You know, maybe I should call them and see what's it all about.
And so really trying to say and reframing the way people think of SNAP as it's a coupon to help pay for your groceries, and it's an entitlement program. It's something that people have paid into, it's something you've worked for, and you know, you should definitely take advantage. And if you feel like you might be taking away from someone else, that's not true.
I saw AgeOptions as an opportunity.
And I love being here. I felt like I was home. That's the only way I can describe it. I was so glad to get out of that nursing home.
It's just so amazing, like Gladys's story, when you can hear the impact that these benefits make on someone's life.
She kind of helped me along. If anything, if I didn't understand it, she'd explain it to me. You know, because when you get older, you don't always comprehend things, you know. So she's very understanding and patient. So that's all I can say.
That's our whole drive for the Peer Mentor program. There are individuals that are just like you that don't have the hope or the support or the encouragement to actually feel that they can transition out.
We're able to help ensure that thousands of consumers throughout the state can access the things that they really need to remain in their communities and stay healthy.
If they don't make the right choices and they don't do it when they should, they could really experience some hefty fines and a lot of high healthcare bills.
I'm healthier. You know, I'm healthier because I'm getting my weight back. I had lost so much weight and I'm getting it back now. So that's a blessing right there. It really is.
So when you feel that burden being lifted off your shoulders, and then you walk into that new beginning that you could call your own, that's a wonderful, wonderful feeling. There's nothing else like it in the world to say more or less, I'm independent. I have my own. I'm back on solid ground on my own 2 feet. That's what AgeOptions gives you, an option to strive to be better. And that's what it's all about.
It makes me feel like somebody cares, and that's how it changed my life, that there are people that are interested in you.
But when somebody cares, it makes a difference. And when people care, it makes a difference. And when people are trying to do something for aged people. You know, it makes a difference in their lives.
I can't say enough about AgeOptions. I'm so appreciative of what they did for me.
But we know that we have the most effective, strongest way of approaching this. But it's not enough. We need help from our community. We need help from people who are participating in our events. We need people to really step up and say, yes, we can see that you've started things, and let's try our best to get them farther along so that we can keep more people healthy, involved, and feeling respected and honored as they deserve.